Hey guys, it's Vlad here. Just gonna give it a moment for people to jump on. Hope everybody's doing well. Um, Today's Tuesday, April 28th. I am in Toronto, Ontario. If this is the first time you tune in, I'm a health and wellness coach for over 20 years, and I became vocal about a month ago with posts on my Facebook, as well as I've been making these live streams for the last couple of weeks now. This is part 7, and I went a little bit with actually noting a few things down that I would like to discuss today, and that's definitely something I want to maybe to go forward instead of just talking out of nowhere per se. Just definitely want to have something like an outline to discuss. So today, first of all, I want to discuss some of the new developments that already been taking place with briefings from on the federal level, from the doctors at the federal level, as well as Ontario and Toronto briefings that I'm following because I am here, but I know there's a lot of things going on in Quebec, and I'll be touching a little bit on that, and that's that. So first off, from the federal briefing, what was discussed today with Trudeau is there was a question about when are we going to be going back to normal life, and unfortunately Trudeau again continuing the rhetoric of saying that there's no back to normal until we have vaccines, and that's been happening for a very long time in his briefings, probably for at least 2 weeks. And I noticed that from the beginning when he started using that phrase, no back to normal until we have vaccines. And World Health Organization using the same outline and vocabulary, and Bill Gates is using the same agenda. And obviously, Fauci in the States is using the same agenda and vocabulary. And it's very troubling when you see politicians around the world, and not even politicians, but people that have a part of the same mindset that this is a pandemic virus, it's extremely dangerous, everyone's going to die out of it, and they're using the same language to push the same agenda. So I definitely saw those things happening. So again, today, when our Prime Minister was asked the question, when are we going to be back to normal and how soon we're going to have vaccines, he literally said the statement that they're working on the capacity to vaccinate everyone, and then he paused, and then he said almost everyone, and like it's crazy to think that this is the agenda again that's being pushed at the federal level, and that's why I'm definitely voicing my real concern that this is something that the indoctrination has been going on at the federal level with Prime Minister, with Dr. Tam and the other doctor. It's crazy what's going on. So to follow up, to continue that trend, the other briefing that I watched today was the Dr. Tam and the other doctor. They announced the new model for Canada, and I have a slides that I took screenshots from the models that they were discussing. And the first of all, the numbers that they're showing is amazing, how they can even try to skew the numbers to show that the death rate in Canada from this virus is over 5%. And it's irresponsible on their part even to present such a data. And then besides that, I'll address that in a moment. And then when they actually finally discussing other countries that we're comparing the information from, and they're trying to figure out what's going to be happening in Canada, the countries that they, I'll tell you right now, the countries that they are looking at to see how this virus is going and how well the government is managing the situation is United States, United Kingdom, Spain, Italy, Germany, France, China, Japan, and South Korea. So the curve that with 2 countries that's doing much better than even Canada managing the situation, one is South Korea and one is Japan. Now, Japan until very recently didn't have a lockdown. That was not discussed at all. However, the main crazy amazement to me that countries that had no lockdown this whole time, one of them is Sweden, which is again, is probably one of the only countries in Europe that's really holding strong and as not following the World Health Organization mandate, is Sweden, and they're doing relatively well. Again, not ideal, but they're doing very different in terms of managing the situation, and that's the case. And then the other country that's not even mentioned at all, and I didn't even know until somebody sent it to me, and that's really what frustrates me a lot is there's lack of any opposing information out there, both in terms of the briefings from the government officials and the doctors, as well as in the media. Like, everything is suppressed. Anything that's going against the agenda that's been pushed on us, it's nowhere to be found. And if anyone is actually sharing any opposing views, those things get deleted and suppressed. But anyway, the other country that nobody's talking about is Taiwan. Taiwan is, super close to China, the epicenter of this virus, and they never had any lockdown, and they're doing relatively well again, managing this whole situation. So at the federal level, our doctor, public health officials managing and creating the agenda for the whole country to follow. They not even considering the countries that don't have a lockdown and actually how well they are doing managing the situation. Well, why wouldn't they consider that? Because that would definitely question their position and would question all the measures that's been taken up to now in terms of trying to reduce the spread, which is, I think, been lost a long time ago. I really believe, like a lot of people out there, that this virus been spreading around, and Canada specifically, months before the lockdown. So the lockdown was completely unnecessary. Try to contain the spread. That should have been done a long time ago. So a lot of people already had the virus, but then now when you implement lockdown measures, people just staying together, and unfortunately the virus getting spread. So at the end of that briefing, Dr. Tam, there was actually a pretty good question period happening today, where the journalists actually were grilling Dr. Tam and the other doctor, like, how are you actually making this model? How are you actually making this forecast for Canada? Like, can you actually show us the real formulas and actual data that you're using to forecast it? And I really encourage everyone to watch for themselves and see how elusive their answers are. And they're not really giving actual formula how they make up all these numbers. And to me, that's actual sign again that when you have a real journalist that asking you a tough question and you can't really give a straightforward answer, it shows to you that they're just making the shit up. Like, it's really discussing what they're doing, making the numbers to continue pushing the agenda, and not examine actual data that's coming out there in the world from places that are actually doing the antibody tests, and they actually doing the research to prove the actual fact of natural immunity. Like, again, over and over again, when someone asking those doctors at the federal level, what about the natural immunity? What about the herd immunity concept? Anything that's naturally can be created within the public, dismissed, and at the same time, right after, it says, once we have a vaccine, that all is going to be solved. So, do you actually think immunity works in people or not? Like, it's a really amazing how they try to push the agenda. So that was going on, and then after that, I was watching the Ontario provincial briefing, and just because I have actually a specific topic I want to discuss later, I don't want to go too much around other stuff. I'll be talking about long-term care homes and situation there. But there's a report that came that there are people dying, and that's definitely been my concern from the beginning, that the current measures are actually killing people. And I've been very vocal and without any apologies, I've been very vocal saying that the current measures are actually killing people. There's real ramifications from creating the agenda that the government is creating in terms of fear propaganda, not servicing the people with their hospital needs and medication and all that stuff, because everyone's trying to make sure that we have enough capacity to manage the surge from this virus, which never happened. It never happened. It's been close to 2 months. It's not happening, and they're still not changing the agenda. They're still pushing the same agenda: stay at home, be fearful. It's crazy. So there was a question asked today at the end of the Ontario briefing, because the report just came out, at least 35 people died from heart disease, cardiac arrest, I believe, because they were not able to access hospital care because of this government's measures. And the journalist actually asked the Minister of Health for Ontario, like, is this actual collateral damage from the lockdown measures? And she said, no, it's not a collateral damage. And of course she's going to say no. because saying those people are dying is a collateral damage of the policies of our government actually would be them taking responsibility and taking the blame for that's happening. So this is what's going on at the federal level, at the provincial level, and even the Toronto briefing today. Again, the journalist actually asked our mayor, Tory, and he was like shocked. Is that a question for me? What does he think of actual people dying out there because they're not able to access hospital care and anything that they need because of the lockdown measures? And he's like, well, I don't know. It's not a really question for me. All the lives matter, or whatever he said. And all lives do not matter, because the policies completely disregard, again, all the horrendous results that are happening out there right now. Again, people, I shared on my page, the doctors from emergency rooms and other hospitals that actually asking for people to come to the hospital to seek the help that they need besides this virus, that people are scared out of their mind and they're not willing to go to the hospital. So it's definitely happening. People are dying because of these lockdown measures. People are dying because of the fear propaganda on all the levels of the government. The real data is not being used to make the policies for all Canada and the province of Ontario. Going back to the briefing that was happening with the Dr. Tam and the other doctor, they were asked again, like they were asked on Saturday, what are their thoughts on some of the provinces, and obviously the conversation was about Quebec. What is Dr. Tam's position on some of the provinces opening the schools and actually embracing, the herd immunity concept and exposing non-risk population to this virus so they can actually get better. So, and you know what, I don't know if my comments that I'm constantly making on all those briefings actually making a change. Maybe they're not, but maybe they do, because today she actually changed her tone. She said that, well, every province is a jurisdiction, they're responsible for their own people, and, they definitely should do what they think is best considering all the situation. And let me tell you, that's a very different language and what she used from Saturday, because when she was asked that question on Saturday, she made a very rude and out of place comment, calling the actions of elected Premier of Quebec actions irresponsible. And I think that was extremely dangerous, and I voiced my comment right away when she did that. And again, we all can go on all the briefings and see everyone's comments. So whether she saw it or somebody of her assistants saw it, maybe there is something that happening in terms of my influence. And yes, people already call me the comments troll, and I don't care. Again, they can call me troll and anything else in between. I don't really care. What I care about is, voicing my loud concern, sharing my passion for making sure that people are understanding what's really happening out there. And it's really, it's crazy to think that out there, any news, anyone that's actually talking to oppose the current agenda that's been pushed by the government and medical establishment is being suppressed. People are getting dismissed in terms of their credentials and stuff like that. And just to give a couple examples, there's doctor in the States that providing high dosage of vitamin C for people to get healthier and at least to boost the immune system. They were raided with FBI agents in the States, and a lot of social media and YouTube videos from the actual doctors and nurses that's speaking out against the current state of affairs. Those videos are getting taken down, etc. So those are some of the things that I wanted to discuss. The Toronto briefing is, again, all the same. Dr. Davila says, staying home is healthy, and that's like crazy. Staying home, it's actually unhealthy behavior that weakens the immune system and makes people unhealthy. So when she's making that statement, again, just shows how disconnected she is from reality, what is real health for people. Staying home is not healthy, okay? They're not even trying to dismiss or hide their agenda. It's crazy. So I want to discuss the long-term care homes. There are a couple of things that I want to mention, and I'm going to share the links to the both things that I'm going to talk about. And I definitely encourage everyone not to take my word, but actually go and look at the resources that I'm going to be sharing. So the first thing that I'm going to discuss briefly, and again, because it's a long report and I want people to take their own time and examine this report, is it's a report about infection prevention and control in long-term care homes. and this was done for Ontario long-term care homes from the data of 2008. So we're talking about 12 years before everything that's going on right now. This was some of the findings. So I just want people to get a little bit of a context to understand that unfortunately what's been going on in long-term care homes is nothing new. And it's a huge failure of a government on all the levels not to be able to protect the people. And I made the statement last week, and it's a very strong statement, and I still stand by it. I really believe that what's going on in long-term care homes is a genocide of our elderly population. So to give you a little bit of the context, and this specific data is from 2008, that we have over 75,000 residents in Ontario in care homes who are over the age of 65 years old, okay? Out of the over 75,000 of residents in those care homes, more than half, over 40,000, actually reside in for-profit nursing homes. And again, this is from 2008, just to give you a little bit of example. And so already, for me, that's a red flag, because I understand how, unfortunately, healthcare places that are run for profit, they use any possible measure to increase the profit. And it's just a part of the business. If anything like that, that's a for-profit run, they're going to look at any possibility to reduce the cost and increase the profit. That's just what the businesses do. That's why, for me, there's no place for for-profit businesses in providing, care for people and healthcare as well. Okay, so that's already something for you to get a little bit of the context, that over half of thousands and thousands of people in Ontario only are in for-profit care homes. Now, at the same time, I'm not saying the non-profit care homes are great at managing, because most of those places are also underfunded by all the levels of the government, okay? So, but just to give you a little bit of the context. Now, the main thing that's discussed in this report, and again, I really encourage everyone to go and take a look at it, that they're talking about healthcare associated infections. And there's a whole list and table of different infections that's going on in the care homes. And it again discusses the objective and the scope of those infections that's going on for a long time. And it gives you the summary that estimated 30 to 50% of healthcare associated infections are preventable in acute care institutions. So the outbreak's been going on for a very long time, and this is just one report. I'm going to post the link. Everyone download it. Everyone study it for yourself. There's different tables and etc. So there's like 27 pages of report. I'm going to share the link. Everyone can download and take a look. And again, this is from 12, 11 years before what's going on right now. The other thing that, in the same context that I'm going to discuss with you, is actually from Globe and Mail. It's an article, okay, an article from Globe and Mail, and it specifically talks about what's going on right now in terms of the outbreaks in care homes. And again, this is nothing new, so I'm just going to give you a little bit of talk from there. So, and again, I'm going to share this link. Please, if you really want to educate yourself and understand what's happening in long-term care homes, download this, look for this article at the Globe and Mail. So they talk in there that, the deaths from COVID, but before this, so the things, so in the fall of 2005, the commission, in the middle of a completing report, Seven Oaks long-term care home, and this is one of the first care homes that they had outbreaks in Toronto. So this example from 2005, guys, 15 years before what happened right now in Seven Oaks long-term care homes, guess what? They had an outbreak of bacterial pneumonia that infected at least 135 people, including 70 residents, 39 staffs, and 21 visitors, and 5 people who lived or worked nearby. And 23 residents died, okay? This happened in 2005. Just to give you one small example how systematic the issues have been in this system, in the long-term care homes. Then there's a talk about the SARS situation and how little the measurements were taken. And, the people are underpaid, the people are they forced to work in multiple locations, and they, and then because we're understaffed, even during this current crisis, people actually who were positive for this virus, they were forced to go to work in a lot of those care homes because the care homes simply didn't have enough staff. So those facilities are understaffed. Those people who work in those cares are hugely underpaid, and they forced to spend very little time on each patient or a person they're caring for, and not even able to clean them properly because they're on a rush, and they have to work at a different location. And again, like today at the Ontario briefing, one of the journalists, and I really, if anyone can help me out and send me the list of all the journalists that are actually asking those tough questions, because I'm just overwhelmed again with all the information I'm trying to digest and present to people. Some of the journalists actually are asking tough questions, and one of the journalists again today at the Ontario briefing was asking the Doug Ford and our Minister of Health, how come the measures were not taken earlier? How come all these measures were not taken over a month ago when people were already at risk of getting this virus and dying? And again, like the health minister of Ontario had the nerve to say that they had a best plan. The path that they took was the best with all the people are dying. Like, there was a disgrace, was I heard today. And it's really crazy to think that the people in power really think that they're doing a job well, and they're thinking that the current measures that they're taking are responsible for small numbers in terms of spread of the virus, and they're completely disconnected from real data, and they're still using the same scientists that gave them their own information to begin with. And again, I mentioned this in the previous slides, but I'll say it again now, that Doug Ford 2 weeks ago admitted that the reason why the care homes didn't have the resources to prevent the spread there, one of the reasons was the allocation of resources all was put into the boosting the hospital capacity, because based on the information that was presented to him by the scientists and the doctors specifically in Ontario, they were told that all the resources must be put in the hospital capacity, and that never happened, and it's still not happening. And because of that, they didn't have enough resources to put into the care homes. And again, I just said, all that system has been underfunded and underregulated and been a total mess for years, for decades. This is nothing new. This is unfortunately what's happening with people in those places, and they're dying, and the government is almost doing nothing to prevent that or help them. To me, honestly, it looks like this was all intended. Like, I know it's a very strong statement to make, but the lack of actual response by the government at all the levels looks like it was almost done on purpose. It's disgusting even to think that, but it looks like it is. So all those places were underfunded and not taken care of properly. And what I'm saying is that, and still today, Doug Ford saying that they're gonna continue with the current measures because they have to listen to the scientists and the doctors, and missing completely the point that if they give you the wrong information before, and you will base all your decisions based on that wrong information from those people, how can you possibly trust the information that they're currently giving you right now and still continuing to push the same agenda? And dismissing again all the collateral deaths that are happening. I'm going to be using this saying right now, unfortunately, that there's a huge amount of people are dying now and going to die in the future because they're not able to access all the things that they need if this lockdown was not in place, if this fear propaganda was not conducted on a regular basis. So yeah, this is some of the things that I wanted to discuss today. I'm going to share the resources that I was discussing today, guys, for you to definitely take a look. Don't take my word for it. Do your own research. Understand what's going on out there. Definitely question the status quo. Understand that indoctrination means that they want you to make decisions without thinking. They want you to go ahead with whatever they're trying to push. If anyone is surprised at all the new polls that came out right now showing that the majority of Canadians are for vaccination, it's total bullshit. But they're presenting this information like it's a fact that mostly Canadians wants it, because guess what? If enough people on social media will see that majority of Canadians are for vaccination, anyone that was possibly hesitant is going to say, well, if majority thinks it's good, maybe I should think the same. Like, it's such basic acts of brainwashing, and they're doing that on a massive scale. And again, like I said, at the same time, any information that goes against this medical establishment agenda, it gets dismissed it gets discredited, and it's censored. It's deleted from YouTube. Like the two doctors from out of California, they did over 5,000 tests and actually really showed the death rate is less than 0.5%. And that video had millions and millions of views. Guess what? That video gets deleted because it goes against World Health Organization agenda and everyone who follows that. So yeah, on Friday I will be doing a live, and I'm actually going to be discussing, how exactly, in my personal opinion, always has been planned for many years. There's so much information coming out, and that's probably one of the reasons why I'm still staying positive in all this current climate and environment, that there's a lot of things that are coming out that are positive, and it is encouraging that people are waking up. And I really want to take maybe this moment to say thank you for everyone that reached out to me. I'm reaching out to a lot of people, connecting with people that understand that there's something else going on out there and we need to question it. And please don't dismiss your own efforts, trying to wake the people up, trying to give people perspective, and at least make other people question what's going on out there. All those efforts are necessary for us to be able to push against what's been laid on us like it's a fact, and it's a total false. Like I said, my hashtag that I want to create and everyone to use is real data versus fake model. And that's exactly what's been going on. This is the same scenario that's been used in a lot of countries out there, where the fake model is presented at first is completely flawed and inflated numbers, how possibly serious this is going to be, and then it doesn't happen. It doesn't happen by like tenfolds, and then they don't dismiss any measures taken based on that fake model. And again, today, like I said, when they discuss an actual real numbers at a federal level, Dr. Tam in the model, they're discussing the actual numbers of people who had, that got tested positive for this virus and then actually recovered. Able to come up with over 5% death rate from this virus is so irresponsible and so crazy, when the actual death rate is less than a flu. But you would have to look at the data that goes against your agenda to even establish such a line. So I'm not surprised at the information that was presented today. I encourage everybody, again, for yourself, go and take a look. I was able to take some screenshots of the slides that they were presenting. So again, I'm going to try to put them all together and for you guys to see. Again, for yourself, look at it, think about it, but please stay present to what's being done to us in terms of indoctrination, in terms of pushing a certain agenda, and anyone who's trying to speak up or do anything that goes against this gets silenced and gets censored, and that's in itself is such a dangerous situation that we all presented with. So yeah, stay tuned for Friday, guys, where I'm going to be discussing I'll be connecting the dots, so to speak, for people. And again, it's my truth. Do your own research, guys, if you have time and want to. But look forward to seeing everybody else on Friday. And definitely leave me a feedback and comment on this live and any other lives that I've done in the past. Stay tuned for the website and blog that's coming up. So then I have all the data and all the information centralized. Okay, love you all. Stay healthy.